record, so I'm going to do that now. Okay, so first of all, we have to talk about the unique nature of pain during childbirth. It's very unique for several reasons. It's part of a normal process. So we usually associate pain with illness or injury, but this type of pain is part of a normal process. And childbirth pain is something that the pregnant woman and her support persons really have months to prepare for. So they can actually acquire skills for pain management, learning relaxation techniques, breathing techniques. So they can actually acquire these skills, and they can also with childbirth preparation classes, kind of have a realistic preparation and knowledge about the labor and the birth process. So again, that also helps. It takes away that fear of the unknown. Um, we know that there's a lot of books out there, there's videos, there's childbirth classes. So a lot of resources are available to help women prepare. But one of the most important things about the unique nature of the childbirth is the pain has a foreseeable end. Okay, if we have an illness and we have an injury, we don't know when this pain's going to stop. But at least with childbirth, we know that labor will end with the birth of the baby. And so there goes the painful contractions. And again, we just always have to remember that pain is complex. There's physiological issues that could cause pain, as well as psychological experiences. And we know that pain is subjective and it's personal. So many women plan their births, and they're concerned about medications or epidurals because they worry about the side effects for their baby. But it is important to understand that although pain is expected during labor, when it actually exceeds a woman's tolerance, it can actually have harmful effects on the mother and the fetus. So a lot of people don't realize that. They're like, oh, I don't want to have my baby have side effects. Well, if you're not tolerating the pain, that can also cause side effects of the fetus. So physiological effects include an increase in metabolic rate and oxygen demand, and that increases the production of catecholamines. So catecholamines are what we call the fight and flight hormones. So those are your epinephrine, your norepinephrine, as well as cortisol and glucagon. So due to the increase of these sympathetic hormones, women might start to hyperventilate to help obtain more oxygen, but they might exhale too much carbon dioxide in the process, which leaves less oxygen available to the baby. And if you have too much catecholamine, too high of a catecholamine levels, the stress hormones actually will reduce the blood flow to the uterus, which means reduce blood flow to the placenta and to the baby. So sometimes the excessive catecholamine release inhibits also the response to their endogenous oxytocin, which decreases the effectiveness of the contractions and can actually slow labor down and contribute to longer periods of pain just because it's a very slow labor. So that's important to know too. As far as psychological effects, we know that people experience pain different, and that's very important. What can be affecting that? Well, maybe they're having difficulty interacting with the infant, or maybe they've had unpleasant memories from another birth, or maybe the support person is feeling inadequate. So all of these can also cause excessive pain. You know, especially if your support person has a lot of anxiety. We know that anytime we're around people with lots of anxiety, usually we start to get anxious as well. So those are some of the psychological effects of excessive pain. All right, we also have some different sources of pain. So what makes labor so painful? Well, first of all, as blood supply is decreased to the uterus during contractions, we start to experience tissue hypoxia, which causes ischemia, causes increased uterine pain. Then we have that cervical dilation and the stretching of that lower part of the uterus. So that's a major source of pain. And then another source of pain results from pressure and pulling on pelvic structures, and that can be like your fallopian tubes, your bladder, different ligaments. That can cause a visceral pain, and usually women will feel that in the back of their legs. And then, as you would expect, anytime you have distension of the vagina and the perineum that occur with fetal descent, especially during that pushing stage, that can be a source of pain. In fact, some women describe this sensation as a burning, tearing, or I feel like I'm splitting apart. So that's how that pain is sometimes described. So again, we have several sources of pain during labor. Um, this is just a quick slide showing pathways of pain transmission and how that affects, and we can just kind of skip past that. Um, we also know that there are physical influences on pain, and that could be the intensity of the contractions. Again, you're going to have more pain the more intense your contractions get. If you're having a larger baby, you might have more pain with the stretching. Certain characteristics of the pelvis might slow down labor. If you're fatigued, it's very hard to cope with pain, right? We tend to get tired and we tend to not be able to cope with the pain, it causes increased pain. And then at the same time, we're causing pain. Our interventions are causing pain. We're starting IVs with an 18 gauge catheter. We're doing vaginal exams. I mean, we're causing pain as well. So there's several physical influences. We also have some psychosocial influences. So we have culture. So many women manifest pain differently. Sometimes in Asian and Native American cultures, women are expected to bear the pain stoically. So they're not supposed to verbalize. They're not supposed to shout out. And as nurses, we cannot interpret this silence as a lack of pain. We can't assume they're not having pain because they're not crying out. Other cultures may encourage women to vocalize their pain during labor. So again, we shouldn't interpret this vocalization of pain as a sign of labor pain tolerance. But one thing we know for sure is that women who are prepared for childbirth, whether they've gone to childbirth classes like Lamaze classes or hypnobirthing classes, things like that, we know that those can significantly increase the pain tolerance than women who are not prepared. So being prepared, you don't have the fear of the unknown, that helps to also intervene in that fear, tension, pain cycle. Okay, so non-pharmacological pain management, things that we can do. We talked about in this last slide, so I won't go over. I think maybe we didn't. So general comfort, again, just making sure that they're comfortable. I usually prop them with pillows and just get them into a really comfortable space. If they're lying on their side, making sure I have a pillow between their legs. Again, reducing anxiety and fear, so staying calm, speaking calmly, encourage relaxation. Sometimes you can do imagery, like those, you're on a beach, you're feeling the sun hit you. As your sun starts to hit your shoulders, you see them start to relax. Hypnotherapy, some women do hypnotherapy. There's actually classes where they can go to where they learn how to make their body respond to pain by relaxation. Hydrotherapy is something else that can happen. Mental stimulation. So sometimes giving them a focal point. So when you're having a contraction, look at this object right here. And sometimes that can also help them focus and breathe through those contractions. And there's a variety of breathing techniques as well. So here in this picture, we see that the woman's got a cool cloth on a woman's head, so helping with that. This woman laying here, sometimes women have back labor where they're feeling all their contractions in their back, and that's usually due to an occiput posterior presentation. So now the occiput, the back of the baby's head, is pressing against that sacrum, and that can cause feel pain in their back. And so one thing that really helps with that is actually providing counter pressure, so trying to push the sacrum back in, and that can really help with pain as well. The person who's in the picture besides the nurse, I think she's a doula, and a doula is someone you can hire to be your support person. They're trained in managing labor and managing comfort measures. They're not medical personnel, but they're good at getting you comfortable and so forth. We are going to talk a little bit about breathing techniques because these are important to know as well, because they can be a good help. There's different types of breathing techniques. One is not necessarily the best, it's just whatever works. The best time to learn breathing techniques is before labor. So that's why it's very good to go to those childbirth preparation Lamaze type classes. But if they haven't learned breathing techniques before, the best time to do that is in the latent phase of the first stage of labor. That's that long period where they're more excited, they're not hurting too bad. That's a great time. When we go into breathing techniques, we always start with the contraction and end with the contraction. So the first thing we do before as the contraction starts, we have them do a big, deep cleansing breath, which is in through the nose and out through the mouth. Okay, and that's supposed to help relaxation. It helps to release tension, and it kind of clears the mind. At the same time, it signals to the support person that a contraction is about to start. So right here we see slow pace breathing. So slow pace breathing is exactly what it says. You're breathing at a slower rate. So a specific rate is not necessarily taught, but you don't ever want slow pace breathing to be slower than half the woman's usual respiratory rate, because we do want to make sure we have adequate oxygen. So usually the breath is about somewhere between 6 to 10 seconds. So it's kind of big, deep cleansing breath, and then it's in through the nose and out through the mouth, and in through the nose and out through the mouth. So it's just a slower way of breathing, but it can serve as a distraction for labor. So again, if you focus on these breathing techniques, you're getting more oxygen, and at the same time, you're able to focus all your attention on your breathing, which helps distract you from the pain. Modified pace breathing is different than slow pace breathing in that it's a faster rate of breathing. So we don't want the woman breathing faster than her normal. We don't want the woman to breathe faster than twice her normal respiratory rate, because that can cause hyperventilation, and then it can also interfere with relaxation. So again, we start with a big, deep cleansing breath, which you can see through the big triangle, and then it's more of a faster pace. So it's more in, out, in, out, in, out, more of that type of breathing. Another good breathing technique when maybe they're having a hard time focus is doing a modified pace breathing, or we can call this combined breathing, I should actually say. And basically, you might start off with, again, the cleansing breath, but you might start off slow breathing while the contraction builds. And then when it's starting to get really, really intense, you can maybe switch to a quicker rate of breathing and then go back to that slower pace of breathing. And again, end with the cleansing breath. I always like to show this one because this is the one you see in all the movies. So you can imagine this is your blowout. So it's your he, ho. And so basically starts with a cleansing breath, and then you're just blowing out. So you're doing that. So you see that little emphasis on every fourth blow. That's your big blowout. So this is more of a pattern pace breathing. This is probably good for that transition stage where they're at their most pain. And that is the end of our non-pharmacological pain management. So just to summarize, I'm going to include 2 little narrated presentations like I did with your antepartum. One is going to talk about the components of the birth process, or the 5 Ps, and the other one is going to just introduce you to the fetal monitoring equipment. We're going to cover fetal monitoring very well in Module 5, but it's important that you do know what the equipment's used, what kind of equipment is used, and how it's used. So I'm going to give you a little presentation on that just so you're familiar with the equipment. I'm going to give you the presentation on the 5 Ps. The other thing I will do is I will post those videos, the high touch nursing care. I have them on Zoom. I have a password that I'll include that you have to use to access them. So again, that's optional, but I think they're very helpful if you're a visual learner to kind of see what I was talking about and see it all occur. I also made that little doodly video that's going to talk about the stages of labor. So I'll be adding those things on today, as well as the recordings of this session. Just a final reminder, your quiz is now open, quiz number 1. It's going to cover modules 1 and 2, so yet last week's lecture and this week's lecture, and that'll be due before Sunday by the end of the day. So Sunday before midnight, that quiz will be due. And again, it's 20 questions. You have 30 minutes to answer them. It has to be done in one sitting. You can't pause it. If you get up and go to the bathroom, it's still infringing on your time. So that's your first quiz. What kind of questions do you have for me?